In the previous section, I shared with you a truth that not many people talk about. When we're over 60 years old, fruits that used to be very good for our health can silently become a danger if eaten the wrong way, at the wrong time, or combined with incompatible medications. We already talked about 5 familiar types of fruit: bananas, grapes, pineapples, watermelons, and oranges. Things that seem harmless but can actually contribute to an increased risk of stroke, formation of blood clots, or cause damage to the brain. But the list doesn't stop there. There are still at least 4 other types of fruit that I want you to know about. These are all fruits that many people believe to be a miracle cure for old age, or that are promoted as superfoods. But in reality, they can silently trigger inflammation in the blood vessels, thin the blood excessively, or cause dangerous changes that you won't even feel until it's too late. I've seen many patients suffer consequences simply because they thought that fruit is always healthy. So today, in this second part, I'm going to continue sharing with you the remaining 4 types of fruit, so that you clearly understand the potential risks, and most importantly, so that you can make the right choices to protect your memory, heart health, and your own independence. Now, let's move on to the 6th type of fruit, a fruit that's praised as a superfood, but can actually become a sweet trap that makes your brain's blood vessels pay the price. 6. Apples, the surprisingly sneaky sugar trap. We all grew up believing that eating fruit is always a safe choice, and apples are often at the top of the list of recommended foods for a healthy life. They're crunchy, sweet, easy to carry, and people often think eating apples can never be harmful. But the truth is, once you hit 60, things are no longer as simple as before. Many people don't realize that apples, especially today's sweet varieties like Honeycrisp, Fuji, and Gala, are grown to have a more appealing flavor, but this comes with significantly higher levels of natural sugar. Just one large apple can contain up to 25 grams of natural sugar. And not all types of sugar are harmless, especially for older adults, whose ability to regulate blood sugar isn't as sharp as it was in their younger years. When you eat a sweet apple, your blood sugar rises quickly. The body is forced to release insulin to handle it. But for people over 60, or those with a history of insulin resistance, prediabetes, or heart disease, the insulin response is often slower and less effective. As a result, blood sugar swings dramatically, putting stress on the blood vessel walls. This is what's truly dangerous for the brain, because the brain is highly sensitive to blood sugar fluctuations, and in older adults, the blood vessels in the brain are often already hardened or narrowed. I clearly remember one of my patients, Mrs. Shirley Adams, 78 years old, living in Michigan. She was very health conscious, practiced yoga regularly, and believed that apples were the healthiest snack. Every afternoon she would eat one large Gala apple. No candy, no processed sweets, just apples. She always thought, how could eating apples possibly be harmful? Then one evening, while chopping vegetables to prepare dinner, she suddenly couldn't remember the name of the vegetable she was holding in her hand. She also began speaking slowly and stuttering. Her family rushed her to the hospital. A brain scan revealed a minor ischemic stroke. Her blood tests showed significant blood sugar fluctuations, mild inflammation in the blood vessel walls, and signs of blood thickening. Her cardiologist believed that her habit of eating sweet apples every day, without pairing them with protein or fat, caused her blood sugar levels to spike and crash like a roller coaster, gradually damaging the lining of her brain's blood vessels. From there, the risk of forming blood clots increases. A tiny clot getting stuck in a brain vessel is enough to trigger a stroke. There's something many older people have never heard. Even natural fruit can become a sugar trap if not eaten correctly. And not all apples are the same. What few people know is that green apples, Granny Smith, contain less sugar than sweet varieties, and at the same time they have more polyphenols. These are compounds that help protect brain cells, reduce inflammation, and improve blood circulation. A very useful tip is to never eat an apple by itself, especially on an empty stomach. Pair it with a source of protein or healthy fat, like a few almonds, low-sugar peanut butter, or a slice of cheese. This slows down the absorption of sugar, helps keep blood sugar more stable, and reduces the burden on the blood vessels and the brain. Additionally, you shouldn't eat apples right before going to bed. In the evening, natural circulation slows down, insulin works less effectively, and the rise in blood sugar at that time can make the blood thicker, creating favorable conditions for blood clots to form. Apples are not the enemy, but they're also not entirely harmless, especially when we've gotten older and our bodies no longer handle sugar the way they used to. At this age, any kind of fruit needs to be eaten with awareness and caution, because even the fruit you once believed would keep you away from the doctor might actually become the very reason you end up in the hospital if you don't know how to eat it properly. 7. Cherries, the hidden danger of thinning blood. Cherries, small, bright red, perfectly sweet. At first glance, they seem to offer nothing but delicious taste and health benefits. People praise cherries everywhere, touting them for anti-inflammatory effects, joint pain relief, and cardiovascular health. In supermarkets, cherries are often prominently displayed with labels like superfood. Many older adults also believe that eating cherries instead of candy or pastries is a smart choice, but cherries aren't always harmless. Cherries contain a natural compound called salicylates. This is the very substance responsible for anti-inflammatory effects, similar to aspirin. It sounds good, because salicylates can help relieve joint pain and reduce inflammation, something many older adults care about. But if you're taking blood thinners or antiplatelet medications, like warfarin, low-dose aspirin, or Plavix, the salicylates in cherries can make your blood excessively thin. Overly thin blood means blood vessels, already weakened with age, become prone to leaking, rupturing, or bleeding. If a blood vessel rupture happens in the brain, the result can be a hemorrhagic stroke, a type of stroke that often leaves more severe consequences than an ischemic, blockage-related stroke. And the most dangerous part, patients often feel nothing before it happens. I vividly remember one of my patients, Mrs. Martha Collins, 80 years old, living in Minnesota. She used to work as a librarian, very meticulous, always maintaining a balanced diet. She took low-dose aspirin daily as prescribed by her cardiologist to prevent coronary artery disease. But she also had a habit that anyone looking in would think was healthy. Every evening after dinner, she ate an entire bowl of fresh cherries. She believed cherries were good for her joints, low in sugar, and delicious. At first, she remained healthy, but after a few weeks, she started bruising easily, experiencing bleeding gums, and occasionally feeling dizzy. One morning, she woke up, tried to step out of bed, and suddenly collapsed. She was speaking slurred, her eyes looked vacant. Her family called for emergency help. At the hospital, a CT scan revealed she had a small brain hemorrhage, a type of hemorrhagic stroke. Blood tests showed her blood's clotting ability had decreased significantly. She hadn't overdosed on her medication, but the salicylates from the cherries she ate every night had compounded the blood-thinning effect of her aspirin, causing her blood to become too thin, and her already fragile brain blood vessels couldn't withstand the pressure. What few people tell older adults is this: fruit doesn't only contain vitamins or fiber. Many fruits also contain powerful natural compounds that can profoundly affect blood vessels, and even brain function. For younger people, the body can still manage these changes. But in people over 60, the liver, kidneys, and blood vessels no longer work as quickly or efficiently as before. Many people also don't realize that concentrated cherry juice contains salicylates at very high levels. Just one small glass of cherry juice can equal the amount of fresh cherries you'd have to eat an entire large bowl to match. This is especially dangerous if you're already taking blood thinners or have fragile blood vessels. So if you love cherries, what should you do to stay safe? If you're taking any blood-thinning medication, Consult your doctor before eating cherries regularly. If you're allowed to eat them, consume only a small amount, a few cherries, not an entire large bowl. Avoid drinking concentrated cherry juice. And absolutely do not eat cherries right before going to bed. At night, blood pressure and circulation fluctuate more, increasing the risk of bleeding. Cherries aren't villains, but they're not entirely harmless either, especially at this age when your blood is already being managed by medication. Because sometimes, the very fruit you believe is helping you stay healthy could push you into a dangerous situation you'd never see coming. Strawberries, a hidden threat beneath the sweetness. Strawberries, bright red, heart-shaped with a seductive aroma, juicy with a bite, a little tart, a little sweet. They hardly seem dangerous. Many people believe strawberries are a safe-to-eat fruit, good for the brain and heart, even classified as an anti-aging superfood. Hospitals often serve strawberries on patients' meal trays. In nursing homes, they're frequently blended into smoothies. Seniors tend to choose strawberries for dessert instead of pastries. But what most people don't realize is that strawberries aren't entirely harmless, especially for those over 60. First issue: pesticides. Strawberries have topped the Environmental Working Group's Dirty Dozen list for years, meaning they're among the fruits and vegetables with the highest pesticide residues, even after thorough washing. This poses a particular danger for older adults because the liver and kidneys detoxify more slowly with age. Chemicals that aren't fully eliminated can accumulate in fat tissue or the brain. Some pesticides are proven neurotoxins, capable of damaging brain cells or weakening the blood vessels in the brain. And since the blood vessels in an older person's brain are already thinner and more rigid, even minor inflammation or damage can trigger a blood clot. This is one of the silent stroke mechanisms, no warning signs until it's too late. But there's more. Strawberries are also high in purines, natural compounds that the body can convert into uric acid. In moderate amounts, this isn't a big deal. But for anyone with a history of gout, arthritis, or weakened kidney function, eating a lot of strawberries can trigger intense joint pain, worsen inflammation in blood vessels, and indirectly raise the risk of a stroke. I remember one of my patients, Mrs. Eleanor Scott, 79, living in Florida. She loved strawberries. Every day, she'd eat at least a small bowl of fresh ones. She believed they were good for her memory and skin. She avoided pastries and ice cream, choosing strawberries as her go-to dessert. After a few months, she began to experience severe joint pain and swelling in her fingers. She often felt lightheaded in the mornings. One day, she woke up with no sensation in her right hand. At the hospital, doctors discovered she'd had a minor ischemic stroke. Blood tests revealed abnormally high uric acid levels, signs of blood thickening, and mild inflammation in her blood vessels. Her doctors believed her daily strawberry habit, combined with an undiagnosed case of gout, had triggered vascular inflammation, thickened her blood, and formed a clot. Here's something most people don't know. Even fruit can become chemical poison if eaten in excess or sourced poorly. In strawberries, pesticides can cling to each tiny seed on the surface. A quick rinse won't remove them. Cheap frozen strawberries, often used in mass-produced smoothies, are typically imported from countries with lower food safety standards, increasing the risk of chemical residues. So, if you love strawberries, how can you enjoy them safely? Choose organic strawberries whenever possible. Wash thoroughly under running water and soak them in diluted salt water or vinegar water. Avoid eating large quantities daily. 2 to 3 times a week, a small handful is enough. If you have a history of gout, arthritis, or take blood pressure medications, consult your doctor before making strawberries a regular part of your diet. Strawberries aren't the enemy, but they're not completely harmless either. At this stage in life, every dietary choice should be made thoughtfully, even with fruits that seem the sweetest. Sometimes, the very thing we think is a superfood can quietly sabotage our health, if we don't understand how our bodies truly work. Mango's blood sugar spikes and trouble with medications. Mangoes, that bright golden tropical fruit, soft, sweet, and fragrant. In the US, many people see mangoes as the perfect, healthy snack. They show up in summer salads, smoothies at health cafes, or get dried into snacks labeled as diet-friendly. Many older adults also love mangoes because they're naturally sweet, low in fat, and make them feel like they're enjoying a luxurious treat. But what few people know is that mangoes aren't completely harmless, especially once you're over 60. Mangoes are one of the fruit's highest in natural sugars. Just 1 cup of diced ripe mango can contain nearly 45 grams of natural sugar, more than a medium-sized donut. And unlike complex carbohydrates, the sugar in mangoes gets absorbed very quickly into the bloodstream. For younger people, the body can still handle this, but for older adults or those who already have a history of diabetes or prediabetes, insulin resistance, unstable blood pressure, this sugar surge can cause many dangerous consequences. When blood sugar spikes, the body releases insulin to process it. But high insulin levels also cause blood vessels to constrict, slow down circulation, and make blood vessel walls more prone to inflammation. In blood vessels that are already narrowed or hardened due to age, this creates conditions that allow blood clots to form. And even a tiny clot in the brain can be enough to cause a stroke. But that's not the end of it. Mangoes also contain a natural compound called mangiferin. Some studies have shown that mangiferin can slow the activity of the cytochrome P450 enzyme in the liver. This enzyme is crucial for the body to process many types of medications, especially heart medications like amlodipine metoprolol, cholesterol-lowering drugs, statins, certain drugs for treating arrhythmias. When the liver processes medications more slowly, the drugs remain longer in the blood, leading to excessive accumulation. The result is, blood pressure medications can lower blood pressure too much, causing dangerous hypertension. Antiarrhythmic drugs can cause the heartbeat to become irregular. Accumulated statins can lead to muscle inflammation, pain, and even blood vessel damage. I remember one of my patients, Mr. Norman Baker, 83 years old, who lives in Texas. He used to be a truck driver, cheerful in personality, always trying to eat healthy. He had a habit of eating a few pieces of dried mango every afternoon instead of cookies. He was also taking blood pressure medication and medication for atrial fibrillation. At first, he didn't have any issues, but after a few weeks, he started feeling tired and often dizzy in the mornings. One morning, as he was getting out of bed, he suddenly collapsed. His wife panicked and called 911. At the hospital, doctors found that his blood pressure had dropped very low. Tests showed that the levels of his blood pressure medication and antiarrhythmic drugs were far above the safe range. A brain scan revealed he'd suffered a mild ischemic stroke. Doctors concluded that the dried mango he ate daily contributed to slowing the elimination of his medications, combined with the high sugar content causing fluctuations in his blood pressure, leading to the stroke that no one had anticipated. What few people consider is that even natural fruits can strongly interact with medications, especially in older adults. And it's not just fresh mangoes. Dried mangoes are even more dangerous because they concentrate the sugar and natural compounds to levels many times higher than in fresh fruit. So if you love mangoes, how can you eat them safely? Only eat mangoes during the day, not in the evening. Eat small amounts. A few small pieces are enough to enjoy the sweetness, not an entire cup. Always eat mango with protein or fat, like a few almonds or Greek yogurt, to slow down sugar absorption. If you're taking heart, blood pressure, or statin medications, ask your doctor before making mango a regular part of your diet. Avoid dried mango or eat it only in tiny amounts because it contains very high levels of sugar and mangiferin. Mangoes aren't the enemy, but they're not completely harmless either, especially at this age, when every fluctuation in blood sugar or drug interaction can lead to consequences you never want to experience. Because sometimes, the fruit you eat to get more vitamins might actually be the very reason you end up in the hospital, if you don't fully understand your own body. After going through 9 seemingly harmless fruits that can quietly raise your risk of stroke, you might be feeling confused or even a bit disappointed. Because all your life, you've been taught that fruit is nature's medicine, a precious gift from nature, something you can always trust. But the truth, especially for those over 60, is far more complicated. Because aging changes everything. The foods you used to enjoy in your 30s or 40s, your body no longer processes the same way. Your kidneys work more slowly. Your liver becomes less efficient at processing medications. Your blood vessels become thinner and less elastic. And the brain, the most sensitive organ, becomes particularly vulnerable to fluctuations like blood sugar spikes and drops, sudden changes in blood pressure, factors affecting blood clotting ability. That means every bite of food, every dietary choice now carries more weight than ever before. I've met countless patients who, with good intentions, simply wanted to stay healthy. They maintained habits that seemed perfectly normal, eating a banana at the same time as taking medication, snacking on a bowl of grapes in the afternoon, having a few slices of pineapple for dessert, or starting the morning with a glass of orange juice. These are habits that feel familiar, very American, yet they can quietly trigger a chain reaction, causing inflammation in blood vessel walls, leading to arterial hardening, making the blood either too thick or too thin, and most dangerously, forming blood clots that can block blood flow to the brain in an instant. As a neurologist, I've witnessed the consequences firsthand. Patients go to bed perfectly healthy, but end up finishing the day in the intensive care unit. Some lose the ability to speak, can no longer walk, or fail to recognize their loved ones. All because of a tiny blood clot no bigger than a grain of rice, appearing in the wrong place at the wrong time. What breaks my heart the most is this. Many of these cases could have been entirely preventable, not through more medication, but through proper nutritional knowledge. So what's the good news? Not all fruits are dangerous. On the contrary, if you choose the right types and eat them the right way, fruit can still be a powerful ally that helps you protect your memory, support your heart, and maintain independence and autonomy as you age. So how should you choose? Berries, blueberries, raspberries, blackberries. Right arrow low in sugar, rich in antioxidants and polyphenols that help protect blood vessels and fight inflammation. Right arrow don't cause sudden spikes in blood sugar and have minimal interactions with medications. Good for memory and natural blood circulation. Granny Smith apples, green apples. Less sweet than red apples, high in flavonoids that help protect the brain. Should be eaten with low-fat cheese or nut butter to slow down sugar absorption. Avocado. Right arrow, many people forget that avocado is technically a fruit. Rich in healthy fats that help stabilize blood pressure and support nerves. Contains potassium, but is absorbed more slowly and doesn't cause sudden mineral spikes like bananas do. Lemon and lime, not meant to be eaten as fresh fruit but extremely beneficial when used as a seasoning. Support liver health, aid digestion, contain no sugar and don't cause medication interactions. Right arrow, squeezing a few drops into your morning water can gently stimulate your digestive system. Pomegranate, with conditions. Right arrow, rich in antioxidants and supports circulation, but should only be consumed in small amounts. Right arrow, if drinking juice, dilute it and limit intake to about 1-2 Oz per day. Consult your doctor if you're taking blood pressure or heart medications. And one extremely important point that few people realize. The timing of when you eat fruit is just as important as which fruit you choose. Eat fruit during the daytime, when your body is active and metabolism is working well. Do not eat fruit on an empty stomach, especially if you're prone to low blood pressure or diabetes. Always pair fruit with protein or healthy fats, like nuts, yogurt or cheese, to slow sugar absorption and help stabilize blood pressure. And absolutely avoid eating fruit right before going to bed. At that time, blood circulation slows down, blood pressure drops, and blood becomes thicker, creating the perfect conditions for blood clots to form. This is not a call for fear. It's a call to respect your body, a body that has carried you through so many ups and downs, worked hard, loved deeply, and lived each day to the fullest. You are not weak, but your body is different now. Right arrow, that doesn't mean you have to give up the sweetness of life. Right arrow, it means you need to learn how to enjoy it more wisely, more mindfully, and in a way that suits your body today. You've made it to this chapter of life with resilience, wisdom, and a commitment to your health. Don't let a small habit or a seemingly harmless fruit become something that silently drains your health. Every choice, even a snack, can bring you closer to mental clarity and stability, or push you closer to danger. Read food labels carefully. Ask your doctor whenever you're in doubt. And think not just for today, but for the weeks, months, and years ahead. Because you're no longer just eating to live. Now you're eating to keep your mind sharp, keep your body strong, and hold on to who you are. With the right knowledge, the right fruit choices, and smart timing, you can absolutely continue to live clear-minded, proactive, and live truly as yourself. Because your brain is listening to everything you put into your body. Right arrow, feed it the future you deserve. If you found these insights helpful, share one thing you've learned and plan to apply in your life. Let's work together to build a community of healthy living, the right way, at the right age, and at the right time.